the pandemic kind of exacerbated a lot of these numbers because now you had people that were in, close confines and not able to do a lot. And so not only were they sharing, not sharing, but not only were they participating in sex, but many times they might have had multiple sexual partners and not going to get checked because health facilities were obviously but basically responding to all of the cases of the pandemic in terms of COVID-19 and things of that nature. So testing is what I'm trying to get to for sexual diseases kind of went on the backside. The people's voice. Welcome back. Welcome back. This is the people's voice. I am Trey Evans and I am the people's voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we take time to say thank you to everyone who's listening to the podcast today. We do understand that you could be utilizing your time to do something else, so we do appreciate you spending your time equity with us today. As always, if this information is valuable, we do ask that you subscribe to the podcast video on YouTube every Wednesday for those of you who like to watch the podcast. But in any event, we say thank you, welcome, and welcome to the People's Voice podcast. So today, I want to talk about a story that got national attention earlier this year. This story did get national attention, but as with most news stories that come out, it has quickly come out and then disappeared. And I want to talk about this today because I think this is a serious health emergency that is currently occurring in this country. So now why this is occurring is because there's not enough conversation about it. So today I'm going to talk about the increase of STDs and STIs here in the United States. So where I'll begin is, as I said earlier, there was a report that came out earlier this year from the CDC, the Centers for Disease Control and Prevention. And they released a report that detailed the increase in STDs from 2017 through 2021, because a lot of these reports takes about 2 years to gather all the data before they release them, unless they're local, but that's something different. So this is on a national level. But they put out a report earlier this year around April to basically alert everyone that STDs had indeed increased over that 4-year span. And so I want to detail that report a little bit, kind of go through some of the highlights of it. Obviously also talk about ways to prevent and reduce the likelihood of STDs, and then we'll close out from there. So looking at this report, one of the first things that stood out to me in regards to STDs is that they kind of gave a breakdown of the state of STDs in the United States as of 2021. And here, and for those of you who are listening, I'm reading from a report from the CDC. Those of you who are watching YouTube, you can see this, but I'm reading this report, and it says, as of 2021, there were 1.6 million cases of chlamydia reported in the United States. That was about almost a 4% increase since 2017. There were over 710,000 cases of gonorrhea. And that was an increase of almost 28% since 2017. And then you had the biggest numbers. You have the increase in syphilis cases, which since 2017, it was, reported to be about 176,000 cases, but that was an increase of 74% since 2017. And then another disturbing fact was that in terms of cases amongst newborns, there were almost 2,800 cases reported of newborns who were tested and revealed that they had syphilis, and that was an increase of 203%. And now this is, particularly with the newborns, has serious complications. Congenital syphilis can really create some pretty bad complications for newborns when they do contract this. Matter of fact, let me play this clip from PBS News where they interviewed Dr. Irene Stafford earlier this year, and she's a doctor with University of Texas Health in Houston, and she talked about what some of the effects are on newborns regarding congenital syphilis. This is syphilis that's passed from the mother on to the newborn. So let me play that clip, and then we'll go from there. But let me
what
play
are
this.
the symptoms? What are the consequences of not treating congenital syphilis?
Well, unfortunately, the infection itself during pregnancy carries a 30 to 40% perinatal loss rate. And if the baby does survive during the pregnancy and is born with congenital syphilis, sadly, the baby will be in the neonatal intensive care unit for over a week, in some cases longer. The baby can have blood problems, liver problems, bone problems, and probably one of the biggest consequences is when the infection itself affects the central nervous system or the brain of the newborn, and that can lead to neurosyphilis, which is quite detrimental and hard on a newborn baby and the family, of course.
And that was, again, this is a report from PBS. PBS did a report on this earlier this year regarding the increase in STDs, and that was Dr. Irene Stafford from UT Health in Houston. But as you heard her note there, the consequences of syphilis and contracting syphilis go far beyond just the parent or the mother itself. This can then be passed on to the newborn, and as you heard, it can have some detrimental effects. But kind of going back to that CDC report, that was one of the first stats that really stood out to me regarding the number of cases of syphilis that have been reported amongst newborns. Going a little bit further into that report from the CDC, or kind of going back to it, as I mentioned, syphilis cases have really exploded in terms of the number of reports. Not only has syphilis been reported to have had a sharp increase, but you then also have a number of cases of gonorrhea that have also been reported. Almost 710,000, again, in regards to this CDC report, 710,000 cases of gonorrhea have been reported since 2017. And again, this report that I'm reading from only goes from 2017 to 2021. We are now going to get into the next report probably won't come out until 2025 that will reflect where we are at from 2021 into 2023, because these cases, again, are not stopping. This is a steady increase. Matter of fact, they're dealing with a serious STD breakout or outbreak, if you will, in the state of Georgia. And not only have gonorrhea cases exploded in the state of Georgia, but you also have an increase in HIV. And matter of fact, the state of Georgia is one of the top states that have reports of HIV. And matter of fact, let me play this as well. This is there was a story done by Fox 5 Atlanta where, and this story, when did this story come out? This story came out last week about the increase of chlamydia and gonorrhea and syphilis cases in Georgia that have increased as of since 2022. Matter of fact, let me play that, and then I'll continue and go
led
from
by
there.
Republican State Representative Sharon Cooper Monday. Georgia public health officials revealed cases of gonorrhea jumped by 40%, chlamydia by 11%, and syphilis a whopping 75% since 2017, as the state remains in the top 5% for most new cases of HIV.
The rates are rising, and we needed to hear from Public Health Department about what they were doing, what they thought we could do.
Cooper said,
and so, as you heard from that report,
the pandemic made the already existing problem worse.
Sorry about that. As you heard from that report, not only are gonorrhea cases going up in the state of Georgia, but you also have an increase in syphilis and chlamydia. But again, Georgia, the state of Georgia, is one of the states that's within the top 5 in terms of the states that have the highest reported cases of HIV. So, this issue is only becoming worse instead of getting better. And again, the purpose of me reporting on this today is because I want to get this information out, because the tail end of that report, as they were saying, the pandemic kind of exacerbated a lot of these numbers, because now you had people that were in, close confines and not able to do a lot. And so not only were they not sharing, but not only were they participating in sex, but many times they might have had multiple sexual partners and not going to get checked because health facilities were obviously basically responding to all of the cases of the pandemic in terms of COVID-19 and things of that nature. So testing is what I'm trying to get to for sexual diseases kind of went on the backside. And then now some of the repercussions of coming out of the pandemic, out of the quarantine, is that you have this explosion of sexually transmitted diseases being reported here in the United States. Some other things I wanted to report in terms of the overall increase, just from a percentage standpoint. And again, I'm reading from a report from the CDC that they put out earlier this year. From 2017 to 2021, it shows it's been over a 7% increase in terms of just the number of reported STD cases. So from 2.37 million to 2.53 million cases have been reported since 2017 until 2021. Again, this report goes to 2021. This data is extracted every 2 years and then reported. So that's why it's going down to it's going to 2021. But again, that's a huge increase, and these numbers are not going in the opposite direction. Some other dynamics that I wanted to report regarding STDs is from a racial standpoint and also from an age standpoint. I guess one of the things that was most glaring to me were the number of cases that were reported amongst young people. And again, I'm going to refer back to this graph from the CDC. And in this graph, it shows that in terms of young people, it says here in 2021, more than half, 51% of all reported cases of chlamydia, gonorrhea, syphilis were among young people ages 15 to 24. So that stat alone is extremely disturbing, that almost over half of the cases regarding STD infection have been a result of or have been reported by young people. Another disturbing portion of this report were in terms of the number of cases that were reported amongst minority groups. So from this report, it's labeled here, and again, for those of you who are listening, I'm reading from the CDC report that was released earlier this year in April. It says people from racial and ethnic minority groups, and it has a breakdown of the number of cases of each STD. Now, I do want to make it clear, in this report, they highlight chlamydia, gonorrhea, and syphilis in terms of what has been reported. But one of the issues is that it requires these to be reported for them to be able to record these numbers. The reporting is very much leaning towards minority groups in terms of transmission of STDs. Now, a lot of this is because, number one, you have, failure in terms of healthcare, right? And access to proper healthcare, access to sexual healthcare in a lot of these communities. Number two, obviously information. Information, I say it all the time, information changes situations. So a lack of information that is either circulated within these communities or not provided to these communities is one of the reasons why you see such a disparaging number in terms of cases between the races, in terms of what that looks like, in terms of the number of reported STD cases in the United States. But that really, I wanted to get the word out there. So, I'll close out with what can be done, right? I don't want to beat the dead horse in terms of just giving bad news, bad news, bad news. This is really about an alert, to alert people to what's going on so then you can spread the word. But what can be done? And again, I've referred to the CDC on this because I said, let me go to the experts, right? So from the CDC, they did a great breakdown in terms of what can be done. So one of the first things they talk about is local clinics and communities. Like I said, again, there has to be more investment and more targeted programs that are placed in the vulnerable communities, especially communities that have minority groups, to have access and information to not only get tested for STDs, but also to become educated about the spread of STDs. It says the private sector plays a role in it. They have to develop new testing methods and treatment methods for STDs, right? Sometimes people are dissuaded because they don't want to deal with the testing process, or they don't want to deal with the treatment process. So there has to be more research done in terms of better ways to not only test, but also treat STDs. Healthcare providers play a huge role. When you go to a healthcare provider, especially for those who live in vulnerable communities, the healthcare providers are responsible for educating their patients to say, this is the potential issue when you're having sex, and you need to take these proper precautions to avoid transmitting, or at least being tested, so you know what you or your partner currently has to prevent the spread of these diseases. And then, of course, the public healthcare sector. They must, again, prioritize support for STD prevention and surveillance. Now, in terms of things that individuals can do, obviously you want to have those conversations with your partner before you engage into any sexual activities. You or your partner should get tested. This should be something that you would want to do to protect your partner, or your partner want to protect you. Obviously, the use of condoms drastically reduces the chance of you spreading the STD. Now, again, it's not 100% prevention, right? 100% prevention is pretty difficult, especially if one partner has an STD. But you want to be able to reduce the chances of transmission of it, or be treated for it so it doesn't lead to something more fatal, especially when you're dealing with especially with mothers who decide to have children. You don't want to possibly pass on an STD like syphilis to a newborn. So communication and testing, and also preventative measures in terms of using condoms and other contraception. Well, condoms, I don't want to say other contraceptions. Condoms, using condoms when you're engaging in sexual activity helps to reduce that. But information is key to all of this. So that's my time for today. That's my time for today. I wanted to get this information out. Like I said, I know we're heading into that season where a lot of people will be in close quarters for the next 3 to 5 months, or 6 months, however long this the colder weather lasts. And so, these conversations, although they may be difficult, you should have these conversations with your partner, especially if you're engaging in sexual activity. As always, if this information was informative, we do ask that you leave a comment. You can reach me on any of the social media platforms. You can reach me at I am Trey Evans on all social media platforms, or you can just Google Trey Evans. In addition, you can reach me at the People's Voice Podcast, which is on Instagram, if you want to leave a comment there as well. But as always, we appreciate you taking some time to listen to us today. Dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute. The People's Voice. The pandemic kind of exacerbated a lot of these numbers, because now you had people that were in, close confines and not able to do a lot. And so not only were they not sharing, but not only were they participating in sex, but many times they might have had multiple sexual partners and not going to get checked because health facilities were obviously basically responding to all of the cases of the pandemic in terms of COVID-19 and things of that nature. So testing is what I'm trying to get to for sexual diseases kind of went on the backside. The People's Voice. Welcome back. Welcome back. This is the People's Voice. I am Trey Evans, and I am the People's Voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we take time to say thank you to everyone who's listening to the podcast today. We do understand that you could be utilizing your time to do something else, so we do appreciate you spending your time equity with us today. As always, if this information is valuable, we do ask that you subscribe to the podcast. That way you'll be notified when each episode is released. We put out a new episode each and every Friday, which can be heard on all podcast platforms. And then we also put out a video on YouTube every Wednesday for those of you who like to watch the podcast. But in any event, We say thank you, welcome, and welcome to the People's Voice podcast. So today,